Have you ever wondered whether your cervical mucus is normal? Did you know that your cervical mucus gives you information about your hormone health and your fertility? Today, in this video, I will talk about what cervical mucus is, why we have it, and what it tells us about our hormone health and our menstrual cycle. And I'll give a demonstration of the 4 types of cervical fluid. Don't worry, it's not real. Hi, I'm Amanda, a women's health naturopath for 10 years now. I've been helping women better understand their menstrual cycles and treating their hormone imbalances to give them back control of their health for a better quality of life. Cervical fluid is our topic for today. Some call this vaginal mucus or even vaginal discharge. I feel like these words, mucus or discharge, evoke a sense of shame or a feeling of like something is wrong with us. So I'll use the correct term, cervical fluid, and maybe together we can all spread the word. Cervical fluid is truly a beautiful and magical thing. It is a sign of reproductive health and healthy hormones, and it is necessary for us to conceive and make new life. I call it the natural wonder of the woman's body. So, what exactly is cervical fluid? It is a fluid that is secreted by the cervix, hence the name cervical fluid. And I'll use this model to show you where the cervix is. The cervix lives at the end of your vaginal canal, which is right here, and it's at the base of the uterus. Now, the cervical fluid changes in consistency and texture throughout your menstrual cycle because of your changing hormones, estrogen and progesterone. Your cervical fluid, it acts like a gatekeeper, either protecting passageway of invaders into your uterus or allowing the passage of sperm, acting like a magical superhighway for the sperm so they can help find the egg. It all depends on what type of cervical fluid is present at the time. So why do we have cervical fluid? The short answer, when estrogen increases, it produces this cervical fluid, and its purpose is to nourish and guide the sperm to the egg for when ovulation occurs. Now, let's look at our cervical fluid in the context of our menstrual cycle. This graph right here represents a 28-day menstrual cycle. To understand this graph and your hormones and all of this anatomy, please check out my 2 previous videos, Anatomy and Hormones and the Menstrual Cycle Explained. Day 1 is the first day of your period. You have 2 phases of the menstrual cycle, the follicular phase and the luteal phase. And the follicular phase is called that because it is here where the follicles that contain your eggs grow and mature. And as they do, they produce estrogen. Estrogen causes the lining of your uterus to thicken and grow, getting it ready for a possible fertilized egg. And at the same time, and more specifically for the purposes of this video, your estrogen causes the cervix to secrete this magical cervical fluid. And your estrogen is highest just before ovulation, and this is when you will notice your cervical fluid present. So when estrogen, which is represented by this pink line, when estrogen is low, you won't notice much cervical fluid at all. In fact, a couple of days after your period, you'll most likely be dry. As estrogen starts to increase, where it's still low, you'll start to notice changes. It will be sticky and tacky and really quite white. As estrogen increases to high levels, high enough to trigger ovulation, this is where the consistency of your cervical fluid will be very fertile, very slippery, and very lubricated. When the brain senses this peak level of estrogen, it will trigger the luteinizing hormone, and it is luteinizing hormone that causes ovulation. This is where the egg bursts out of the ovary and into the fallopian tube. It is here where the sperm has been waiting patiently, being nourished and transported by the cervical fluid, and it is here where fertilization will take place. Now, once ovulation has occurred, we now move into the luteal phase of your menstrual cycle. Here, estrogen will drop before it increases again. But the main thing to note here is that progesterone is now being produced in much larger quantities than the estrogen. The progesterone dries up the cervical fluid as there is no need to nourish and transport the sperm as the egg has been and gone. It is usual from ovulation to the next period to not see your cervical fluid until your next follicular phase and estrogen increase. The typical pattern that you will observe throughout your menstrual cycle goes something like this. Your period, you will have dry days. As estrogen starts to increase, it will be sticky and tacky, and then as estrogen increases, it will change in consistency to the fertile, slippery cervical mucus. Then, once ovulation occurs, it will be dry until the next estrogen increase in the next follicular phase. I know that there are some of you that are screaming at me right now because you've been paying attention to your cervical fluid already, and the pattern that you see is not the pattern that I've just explained. Everyone is different, and over the 10 years that I've been practicing as a naturopath and helping women track the cervical fluid, I have seen so many variations. I have seen menstrual cycles where the cervical fluid is present for the whole menstrual cycle from period to period. Or some where there is little cervical fluid from period to period. Some see 4 types and others only see 1 type of cervical fluid. Some will see small amounts of just 1 or all 4 types, and others will see copious amounts. For some with longer cycles, or for those who haven't got their period yet, you might experience cervical fluid for 3 to 5 days, and then you'll see 3 to 10 days of dry, and then you'll repeat this and see cervical fluid again. For some menstruating people, different variations of cervical fluid can be healthy and normal. For others, these different patterns of cervical fluid can indicate an underlying hormonal imbalance. So tracking your cervical fluid can provide us natural healthcare practitioners so much information. We can understand what hormonal imbalances may exist, and then we can select the right treatment because you've been tracking this information. What is our body trying to tell us when we see our cervical fluid? Your body, by the presence of cervical fluid, is telling you that estrogen is increasing and your body is working towards trying to ovulate. This cervical fluid is helping you identify your fertile window, where you see a change in consistency from infertile to a more fertile cervical fluid. Identifying your fertile window is the most important thing for you to know for conception or for contraception. If you are trying to conceive, it is here in this fertile window where you can enjoy having sex. In fact, you need to have sex during this time in order for conception to be possible. If you do not want a baby at this stage in your life, it is this fertile window where you will either abstain from sex or you will use other barrier method contraceptives that will prevent the sperm from entering the vagina and meeting with the egg. This one sign, this magical cervical fluid, tells you when to have sex when you are trying to have a baby, or when to use contraceptive methods when you are avoiding falling pregnant. But what your cervical fluid doesn't tell you is if you have actually ovulated. It only tells you that your body is attempting to ovulate. The cervical fluid's purpose is to transport and nourish the sperm on its way to your egg. The sperm can live inside your cervical fluid for 4 to 5 days, getting into position and waiting for that exact moment of ovulation. After ovulation, your egg will only survive for up to 12 to 24 hours. After this time, the egg will be reabsorbed by your body and your fertile window is over. You can confirm ovulation if you are tracking your basal body temperature and you see a consistent rise in temperature. I'll be covering basal body temperature in my next video, Signs of Ovulation, so hit that subscribe, hit that notification bell to be notified when that video is released. However, it is likely that you ovulated if 2 things happen. 1, if your cervical fluid dries up after ovulation or after your fertile window, indicating that progesterone production is happening. And 2, you get your period 11 to 16 days after your fertile window ended. Tell me in the comment section below if you think that this information is useful and we should learn this in sex education at school. Let's have that conversation. Now we get to the good bit. How to identify the 4 types of cervical fluid. I will describe the 4 types. 2 are generally infertile and the other 2 are fertile. And some may see a bit of a crossover, and this makes sense as the hormones are increasing. You may notice the fertile cervical fluid for 3 to 6 days, but on either side of these days you still could notice the other infertile cervical fluid types. First, I'll talk about the non-fertile cervical fluids. Now, the first cervical fluid I will talk about is usually white or a yellowish mucus looking consistency. It is white, it is tacky, it is sticky, and it could have a chunky consistency, kind of like a pasty glue. So here I have some glue. It's the Clag glue. The smell of it reminds me of school. And it's similar in color and texture. So you can see that it's white and pasty. It has a thicker, chunky consistency. It breaks apart when you move your fingers and you touch the glue together, and it doesn't stretch at all. And this consistency makes it really hard for the sperm to swim through. Now, when this is real cervical fluid, you will notice that when you rub your fingers together, it disappears. And that's because it's mostly cells and not really much fluid or mucus at this stage. Now, the next fluid you might see is like a creamy mucus. It still has a thick consistency. It still could be white or have a yellowish tinge, but it's more like a lotion consistency. So I have lotion here for you. It's still white and thick in consistency. This has a smoother texture and a smoother consistency, but it doesn't stretch when you rub your fingers together and pull them apart, as we'll see in other cervical fluids. Now we move to your fertile cervical fluid. An obvious difference between infertile and fertile cervical fluid is the color. Infertile cervical fluid is white or has a yellowish tinge, whereas fertile is usually quite clear or partially clear, or it also could be an opaque type color. And this is a beautiful sign of health and a beautiful sign of great estrogen levels. And the third type of cervical fluid that you may see is watery. It is clear and it's hard to see and notice unless you can actually see it glistening against some light. It is like this because the water content is so high. It has a very slippery and lubricated feel when you rub your fingers together, although you won't see any stretch when you put the fluid in between your fingers and pull it apart, but this is very fertile. And the fourth type of cervical fluid, and the most famous one, is the raw egg white-like consistency. This may be clear and opaque looking, and when you rub it in between your fingers, it will hold the consistency. And here, I have to get really close, you can see how it stretches when you have your fingers together and you pull it apart. This is very lubricated when you run your fingers together, and it's very slippery. So real cervical fluid can stretch from 1 to 2 inches, sometimes even more. You can see that really stretchy consistency, and it's harder to break apart. This, my friends, is really fertile cervical fluid. So you've just seen the tactile changes in your cervical fluid. However, it is actually possible to feel the changes at the vaginal opening around this time in your cycle. It's those moments where you're standing in the grocery line and you're like, did I just get my period? Did I just pee myself? Nope. That's just your beautiful, magical cervical fluid telling you that you are fertile. The sensations that you might notice, it could feel a little bit wet around your vaginal opening. It could also feel slippery or lubricated, and it might even feel a little bit cold down there. Tracking these sensations is as important as tracking the 4 types of cervical fluid. Now, the big question on everyone's lips is, how do we observe this cervical fluid? You can observe your underwear and visually record what you see. You can also observe the toilet paper as you wipe. Now, a tip here, obviously we're all wiping from front to back for hygiene purposes, and at this time in your cycle, the toilet paper will glide right over you and might even be a little bit slippery. Now is the time that you want to push that toilet paper together, pull it apart slowly, and you are likely to see that egg white consistency of cervical fluid. And you'll be so excited you'll want to scream into the world and show someone. Or is that just me? These observation methods are really great if you are young, in your teens, or you're just not comfortable yet with further exploration. But the most accurate way to observe your cervical fluid for menstrual cycle tracking and fertility purposes is to insert your finger about 1 inch into your vagina, and this is best done daily. I know that sounds like a lot because you're like, hang on, isn't our fertile window just in the middle of our cycle? But what you want to do is you want to insert your fingers once your period finishes all the way to your next period. And the reason being is because you want to know when it's there. You want to watch the changes, but you also want to know when it's not there, because that is as important. And you want to know if it shows up again. Well, I think it is very clear why we should all be tracking our cervical fluid. 1, it allows us to identify our fertile window, which is really important if we're trying to conceive, and just as important if we are trying to avoid a pregnancy. 2, it tells us that our body is working just the way it should be and we are producing estrogen. 3, it might hint that we have ovulated if the cervical fluid stops. and then 12 to 16 days later we get a period. And most importantly, it can give us valuable information about possible hormonal imbalances. And with this information, a qualified health professional can help deliver the correct treatment to help balance your hormones. And so the next question is, how do we track our cervical fluid? A period app is a really great place to start. On most period apps, they have fertility sections where you can actually track each of the 4 types of cervical fluid. Mine, for example, has a fertility tab where you can select sticky, creamy, egg white, or watery. An app is really great because you carry your phone with you everywhere. You can record right then and there if you have any sensations or what you observe on your underwear or even on the toilet paper. It's also useful because at the same time you track your period, and most apps allow you to track lots of other symptoms that happen around your menstrual cycle. A calendar or a diary works just fine too. Some people will even color code. For example, their period will be red, obviously, and some will even use different colors for different types of cervical fluid, or you can just put a letter to represent each type. Whatever you use to track your cervical fluid, just start right now. Start paying attention to the sensation at your vaginal opening. Start paying attention to your underwear and start paying attention to your toilet paper. And when you're ready, insert your fingers to get a real gauge of the 4 types of cervical fluid when you see them and when you don't. And start to notice what I talked about in this video. Whether you can see or feel that it is sticky or tacky, smooth like a lotion. And then when you see that stretchy, raw egg white, get excited. Come back here and comment and celebrate with all of us, because you are on the journey to becoming the expert of your body and your menstrual cycle. We now know that cervical fluid is just one way your body is telling you that it's trying to ovulate. But there are more ways to identify ovulation, and I cover that in my next video, 10 signs of ovulation. So if you want to be more in the know, watch that next.